Hello, everyone, and welcome back to Stroke of Reality, where Jessica and I talk to you about questions, concerns, and how life has been as a stroke survivor and what goes on. So, I want to bring back Jessica, who's just gotten back from her operation, minor procedure she had to go through. As you know, I did my last video by myself, and we talked about Jess a lot and what she's gone through. So Jess is back. Welcome back, Jess. Glad
Thank
everything went
you.
well.
Me too.
And
Well,
just
and there's no such thing as minor brain surgery, Kevin.
well, I want to call it minor because you're not dead. Sorry.
Knock
You know what
on
I mean?
wood.
Yeah. So what we want to talk about today is this is a little bit of a, even for myself, a little bit of a different situation because, having someone have to go through other processes in the recovery. Most people think stroke, have their brain injury, get fixed, do all the rehab, and it's just a way you go back to normal. But obviously, just when she had her stroke, there are a lot of complications in doing it. So the one thing she talked to me about is moyamoya. So just maybe as we go through your whole procedures and everything you've gone through, maybe first of all, let's talk about you had your stroke on New Year's Day and you were rushed to the hospital, as I recall from one of our other videos,
Mhm.
and you were diagnosed with moya moya. Is that correct?
Yes.
So maybe you can tell people what is moya moya.
Ugh. Yeah, moyamoya is a very rare genetic disease. Don't Google it. It's depressing. So what moyamoya does is it, for however, whatever reason, it attacks the main vessels or arteries to your that provide blood and oxygen to your brain, and it restricts them so that the blood and oxygen essentially slow down or stop. And your brain being so smart creates these other neural pathways or collaterals that will take over from that affected area to provide the blood and oxygen to your brain where it's restricted. And my collaterals were so fine and thin that when my blood pressure spiked, one of them burst. It was too much pressure, and resulting in a right hemorrhagic stroke on my right side. And because moya moya is progressive, it will keep moving and finding other areas to restrict. Again, we don't know why. There's still a lot of research to be done, and once they find it, I'm looking forward to understanding once they do find out why it does what it does. But because of that progression, my I had two cranial bilateral bypasses done both on my right and left side back in 2023, my stroke year. And I had indirect bypasses done. It's where they harvest a vessel from inside your brain and lay it on top of the impacted area to help bridge the blood flow from the impacted area to the rest of your brain to prevent an acute stroke risk. And so I had both of those done in 2023. Unfortunately, those did not take or did not work. My body was supposed to absorb those vessels, and and it was supposed to flow like the
So
river.
you
Yeah.
so basically it sounds like, I mean, not to be gruesome or anything, it sounds like it's almost like you had like a bug in your brain, and it was kind of running around because it can go out one door, it goes to another.
Mhm.
So when you went in, from your recollection of your when you went to emergency and everything, did they diagnose this right away, or did it take a few days to realize that the reason for your stroke was not atypical?
They actually, I believe, diagnosed it right away. Under the
Okay.
scans, moya moya looks like a puff of smoke, or
Uh,
smoke of the dragon. So moya moya is Japanese for puff of smoke. Because of those tiny collaterals that form once the restriction takes place under a microscope, it looks like a puff of smoke. And so once I was scanned and they were in there fiddling around, they saw that puff of smoke. And so they diagnosed me, I guess, while I was in my coma. And when I woke up 20 days later, they told me that I had moyamoya. And we're familiar with it because my niece also has moyamoya. She was diagnosed before me in 2019.
Wow. Yeah, and I understand she also had a stroke after you did. Is that correct?
Before.
Oh, before you. Okay, so you were they had sort of that history of the family history of that. Does that mean when they went in and you said you're in a coma, you're basically out of commission for 20 days? Like you're
Yes.
basically knocked out, wiped out, and as you're in a coma, and obviously you don't know what's going on, but what have they told you in terms of you're in a coma? Did they induce it or you went into a coma because of the situation?
I believe they induced me into a coma for 3 weeks.
And that was going to help eliminate the moyamoya or help them kind of keep it in captivity so that it didn't spread further.
Yeah, what the coma does is slows the deficits, slows the
Oh.
damage. So they use it to control the damage, the progressive damage that a stroke causes, which I'm sure many other survivors out there were put into comas as well.
Yeah, I've heard that. There are other people, I don't know if it's moyamoya or what they have. I've met a few people when we were in New York. There are a couple of people I met that were put into induced coma. So part of
Hmm.
the reason we are talking about this today is, because Jess has experienced something completely different. I want people to understand too that are watching this video that stroke is there's so many varieties, so many variations of stroke, and part of the problem in the healthcare arena is the brain is such a multifunctional organ, and we just can't get right in there and just open it up and just fix it. There are a lot of different things, so going through something like that. So you come out of the coma, let's take it to the next level. You're obviously told what happened, you see your family, they tell you what's going on. Do you remember anything of that? Like it's completely a blank in being in the coma itself?
Yeah, the being in the coma, I had no clue. I was asleep, all right. It just felt like I was asleep
So you
for a
like
long
you had
period
a
of time.
yeah. So you thought maybe you were asleep for a couple of days and just woke up.
Yeah. Well, waking up with people all around me, doctors and nurses. I woke up speaking a different language,
What language is that?
Spanish and Italian.
Really? Oh
Yes.
wow.
See?
So in the case of when they found the moya moya, you said so did they have to actually cut right into the skull and go
For
in
the
and do
stroke. Yeah.
for the stroke itself?
Hmm.
Okay. And then that's the remnants you had or the scarring is from them having to do something like that.
Yes. So when they decided to plan my bilateral bypasses, they originally went into my original stroke scar. I don't know if you can see it kind of in there. So they cut me open right in here. It's a little bumpy.
Yeah.
So they reopened the original stroke scar to go in and fiddle around for the right bypass.
Okay.
And they
So
made
then
a
you had said
new incision for the left bypass.
okay. And so once you woke up, did they have a general idea whether it was successful or you said something about not being successful? Was that determined right away after you woke up or a couple of weeks later, a year later?
I was alive. So that was the first box to check, right?
Yeah.
So I was alive. So that was, ding number 1. And then it wouldn't be until years later until we would find out that the bypass was not successful.
Okay. So what you're saying to me is the operation could have really turned 360, and you might not have waken up from the coma. Was a possibility your mother and father and your boyfriend were told?
I don't know that. So originally we went in for the stroke surgery, and it wasn't until a few months later we went back to get the first bypass done.
Oh, okay.
And
Okay.
then
So this
another few months to get the second bypass done.
Okay. So it wasn't just they do it all at one time. You had to keep going
No.
in and out of hospital. So your
Yeah.
hospital, how long did you stay in the hospital? So you went in and had, they were looking at everything. How many, roughly, how long were you in the hospital for everything in terms of the initial stroke and
Hmm.
then doing the other operations
It was 3 or 4 months.
of complete going back? So does that mean in the meantime, while this is going on, you couldn't do any rehab, you couldn't do any physical activity in terms of, trying to recuperate?
It was low impact. So it was first learning to walk, as you know, is
Yeah.
the first goal that physical therapists set for us. So learning to walk and trying to get my left arm and hand to work again. So very low impact, no lifting of any weights.
How did you feel like from thinking, if you, I know this is going back a few years, but in terms of the mental side of things, like being able to think, being able to process, being able to do, how was that from the whole process? Like, how did you actually feel? Or do you
Uh,
recall?
I felt like shit. Is
Okay.
what it was.
Oh,
I knew I felt like me, but I was not me.
yeah.
I looked in the
And
mirror and I did not see myself. So it was not a good feeling.
yeah, so the cognitive really took over in terms of, how your mind was working. And
Yeah.
and and the reason I asked the question because a lot of times people don't realize, Jess has gone through a traumatic brain injury, like with the, having to do operation and all that. And even then it's, it feels even worse because you don't know what you've gone through. So was it explained to you immediately with the coma, what their process were? Were you able to have a good understanding of the severity of your stroke?
I don't think I comprehended the severity of it until weeks later
Okay.
after I was sent home and I tried getting back to normal and
Yeah,
realized that that was never going to happen.
right. And so, with the procedure and everything you've gone through, so we're gonna fast forward now into the next year. So this all happening in what year? 2022?
3.
23. So 2023, everything takes place. You have the stroke. So look, we're looking at 24 into 24 coming up to the first year. How were things for Jess at that time? How did they find you still, as you said, you still didn't know if the things they did inside were working. That, you assumed they were for now because they hadn't put you, you didn't have to go back. But
Right.
how did you find the recovery? Was it getting easier? Were you feeling more like Jess?
No. It was
No.
I mean, it was day by day.
Well,
My emotions were all over the place and to be honest, they still are. So,
yeah. Yeah, the recovery is, as we talked about many times, is forever. And
mhm.
as I said, I've had the pleasure of meeting just a few times, and I know there has been significant improvement. Even today, as we talk about this, Jess is telling me things that we never got into these details, and I find it's important for the listeners because, we talked about one of the things I talked about last week or the week before, just was being the CEO of your body, and that means understanding it. And you're the only one that knows how you feel. Doctors can tell you 19 different things, but really only you do. did you find at the point of that, were you really the CEO of your body? Like, did you feel you had some kind of control, or did you just really feel like, with Jason, your mom, who were being your primary caregivers, they basically took over and you just kind of allowed them or followed their lead?
I was more of the executive assistant of my body rather than
Yeah.
CEO. So I helped out. I don't know who is in control, God, I guess. But it took, and it still takes a lot to try and move my arm. It takes a lot of focus, as you know, to move my affected side
Yeah.
and to even attempt to, walk around without falling or tripping.
Yeah.
So I never felt in total control of my body, and still I don't.
Okay.
My head was very cloudy and very foggy, and depended on the amount of rest I got the day before or the day of to really determine my ability to get up and do something outside of rest.
Right, right. So we are now, let's look at 2025. Last year, we
Okay.
are in 26 this year. So 2025, you've gone through your first year anniversary,
Yeah.
2024, coming towards your second. At what point were you going to see your neurologist pretty regular to keep checking on the situation with your head and what was going on? Or were they kind of giving you space and, maybe 6 months, a year later, they kind of did a revisit?
Kevin, what blew my mind was that my original neurosurgeon that saved my life and conducted the first two uh, bilateral bypasses, after the 6 months of engaging with him, moved away. And so I was out of a neurosurgeon that knew my brain.
Like moved away to another country or moved away to another state?
State. I
Oh,
wasn't
wow.
moving to Boston.
Oh, so you couldn't even do you couldn't, I guess he had to release you as a patient because he doesn't
Yeah.
work for that hospital in Pennsylvania anymore. So
Yes.
how did you manage to find another neurosurgeon? Was you passed over or you had to do a look for?
He did introduce me to another neurosurgeon within the same office. Uh, and then that neurosurgeon ended up retiring or leaving.
Oh, wow.
So I already went through two neurosurgeons within the first year of having my stroke.
So that really had an impact on, I
Yeah.
guess, the process because you had mentioned, the failure.
Hmm.
So I guess then we're still in 2025. Is it by then you did get another neurosurgeon to take you on, or the beginning of 2026 this year when things got a
It
little
was,
clearer?
yeah, it was 2025. But unfortunately, here's where, having to be your own advocate is so important, for each of us.
Yeah.
That new neurosurgeon was in a new healthcare system here in PA. And that new neurosurgeon was not or had no sense of urgency. I'm still waiting on them to call me back to schedule an appointment to read my scans from 2025.
Oh, wow.
So, again, it's so important to be your own advocate. I know and I knew having the disease that I have that is progressive, that causes massive strokes, um, that I need a neurosurgeon that knows what they're doing and that will treat me like a human. So I continued my search.
Yeah. And that's part of, again, I'm learning these new things today as we talk because we didn't get into these deep
Yeah.
things. But it only proves the point. I'm hearing it over and over. What Jess is going through and describing is people having the frustration. And for those that listen in the healthcare industry, this is what you have to understand. I know it's overwhelming. There's so many people with different problems, but someone like Jess who's young, who's still trying to figure out needs, someone to give her advice, what to do, what's going to go on. Let her have the confidence and knowing that all she's been through was for naught, that she can get better and everything else. And again, advocating, CEO of your own body, advocating for your own body is so relevant. Don't stop until you get the answers you need. I've heard that many, many times from different people because they get frustrated not knowing. We all want answers. It doesn't matter if you have a stroke. Doesn't matter if you broke your leg. They just want to know. We want to know how our body stands because just
Mhm.
might want to go running, and maybe she feels like she can, but maybe the body isn't ready for that. But she needs to know that. I had a friend like you who had the stroke, and he was not given any advice after his stroke because he had no physical damage that they had seen. He just had an eye problem, and this he just had last year. So he was advocating for himself to do his own exercise. He started walking, doing all these things. Now, should he have? Well, he will never know because he's done it, but he's recovered quite
Yeah.
well. But those are things people need to understand. Okay, so now we're at the point now you missed our last show. So let's talk about that. So is this with another neurosurgeon or the same one that you then had set up, or they had set up a procedure to go back in, right?
Yes. So in 2025, that's when we started noticing some funky things happening again. My unaffected side was getting weak, and I had fainted a number of times. And so that is why in toward the end of 2025, I had gone into the ER to get scans and to get checked out just because things weren't weren't acting the way they were supposed to act. And so I had a number of scans done. And because that one neurosurgeon that has no sense of urgency never called me back, I decided it was time I found another one. And thank God they had space to take me in. And when meeting with that new neurosurgeon, who is my neurosurgeon now, uh, we found out that my moyamoya had progressed more so than we had hoped, and that's when we found out that the bypasses, in fact,
Didn't
were
work.
ineffective,
And
and that
is
I
that same?
was
Is he still in this? Are you in the same hospital or a different hospital?
different hospital than when I went to
Yeah,
from
where you
my
started.
original stuff. Yeah.
Yeah. Okay. And then you had to go advocate, go find one that was going to take you on.
Yeah.
So let's talk about the procedure. What happened a couple weeks ago? What did they actually do?
Yes. So the moyamoya had progressed significantly on my left side.
Mhm.
Um, And with that said, my neurosurgeon said I was a perfect candidate for a cerebral revascularization, which is a mouthful. Um, and what they wanted to do was instead of the indirect bypass where they built the bridge, he wanted to do a direct bypass, which
Oh,
I, in my mind, think of as like two pipes being welded together with that noise and that to allow the blood flow to go between the pipes.
and then that's what they ended up doing.
Yes, so he originally wanted to do a double direct
Yeah.
bypass correction, but we ended up only focusing on my left side because that was the urgent side that needed to be done. Because I was walking around like a ticking time bomb, Kevin. I could have had another stroke at
And
any
on the other
moment.
side. Yeah. And the
Right.
other side.
And I'm
Wow.
right-handed. I need this. So,
Hmm.
so that is why we only decided to go in and get the, you can kind of see the
Yep.
scar underneath there.
Yeah.
Um, Only do the left side because my right side is a little more complex because I have a prosthetic plate and a lot of scar tissue
Mhm.
there from the original surgeries.
And so, based on what you know today, and I think you still got to do a follow up, I'm assuming.
Mhm.
What's the prognosis up to today that you're aware of?
The
It would
prognosis, sorry to cut you off, the
no,
prognosis is that moyamoya is still a progressive disease, and I will always have to monitor my brain on both
right?
sides for the progression of it and stroke risk. So I have a follow-up appointment with my doctor on July 7th to discuss the progression of my left side and the right side. So I do think we'll have to go back in to the right side to correct that, but we don't have a date for it yet.
Okay. Well, yeah, we're gonna keep following you on this progress as a part of our
Mhm.
podcast and all that, and it's good to know again. It kind of speaks to the fact that I'm glad you're here. You look good in terms of being able to do the whole podcast without any real major issues of conversation and that.
Mhm.
So bless you for that. But it also speaks to the fact before we wrap up that you know, being CEO of your body, being aware of your things. If Jess was not aware of doing these kind of things, she might not be here today because, as she said, the progression was so bad it could have damaged her whole situation moving forward. I, like you, did a CT scan last month because I talked to people like you. I've heard your stories. I hear what goes on. And for me, that's so important that I finally, after 12 years or almost 12 years, I had an x-ray of my head. Did they
Oh
find
yeah.
anything? Did they find anything? No. But it was great. They didn't have anything to find, but I was getting small headaches, and I know some people that I've talked to have had headaches, severe headaches that caused their stroke. I didn't
Mhm.
have that when I had mine, but it did was a concern. Hearing your story, I said I got to do something. So, advice out to people before we wrap up: make sure you're CEO. Even if your caregiver wants to not or do or push you to do something, only you know what can go on. I mean, Jess is still working out, doing her rehab, working on things. We talk about it all the time. And I'm glad that she's got the capabilities and is able to, do these things. But uh, advice out from my side is make sure you take care of yourself. Stay aware. Jess, anything you want to say before we sign off?
I think it's always important to advocate for yourself and don't apologize when it comes to your own health, mental or physical health. So sometimes you have to push through and be a little more assertive or aggressive when it comes to that. Unfortunately, that's just the world we live in. And always lead with gratitude and be kind to your mind. The reality is, stroke sucks, but we made Kevin and I made it through it. Doesn't mean you can't. It's a lot of work, but God doesn't give you anything you can't handle. So let's get through it together.
Yep, absolutely. And on that note, Jess, welcome back. Thank you very much. To our listeners out there, we'll be back another week or so. We'll have another topic to talk about, and we will continue on Jess's journey to see how things progress. We'll pray for her and everything else. And hopefully the next news is good. And good on you for finding another surgeon, a
Yeah.
neurosurgeon that's going to help you and actually be invested in your life, because that is so important in recovery, that the people you in the healthcare system, that they be there with you and help you out. I know it's frustrating at times for them and us, but that's all part of the whole recovery process.
Amen.
Jess, pleasure as anything.
You
We'll
too.
talk again in the real soon.
Sounds good. Thanks, Kevin.
Thanks.